Hello, my name is Reinaldo Lopez, and my case presentation is over concussions and post-concussion syndrome. The typical patient presentation. A 17-year-old male presents to his physician with nausea, memory issues, and dizziness. He experienced a hard hit during his football game earlier in the day, and the patient's head hit the field with much force as well. The athletic trainer said that the patient didn't know where he was when they had done the initial examination on the sideline, but no other symptoms presented at that time. The definition of a concussion. A concussion is a complex pathophysiological process affecting the brain induced by a traumatic biomechanical force secondary to direct or indirect forces to the head. The etiology of a concussion, which is the direct or indirect injury to the head and the acceleration or deceleration of the brain, which causes the brain to impact with the skull. There are three different types of concussion that you could have. There's a coup concussion, which is when the brain impacts with the same side of the skull that the force had come from. The contra coup, which is where the brain impacts with the skull on the opposite side of where the impact had occurred. And torque, which is the rotational force that usually results in the typical loss of consciousness that everyone thinks when concussions are brought up. The background of a concussion. There are 1.6 to 3.8 million sports and recreational concussions a year. 65 to 95% of deaths in sports are due to brain injuries. And 10% of contact sport participants sustain a concussion yearly. 282,000 are hospitalized per year as well. And an important date to note is that in 1906, the first death from a concussion had got its publicity. And an important figure in concussions is Bennett Omalu. He is the pathologist and Nigerian physician to first describe the chronic traumatic encephalopathy in American football players. This is better known as CTE and has been getting traction due to the deaths and suicides of many professional football players. He also published his findings as well. The risk factors of a concussion. Advanced age is one risk factor to look out for, and this is due to the increased falling risk that comes with people later in life. And with the falls associated with elderly people, everyone thinks of falling on their hip or they fall on their butt, which doesn't seem like that big of an impact, but it does cause concussions. Another risk factor is early age, with the increased rate of risky activities. And risky activities can be defined as participating in high-risk sports, like stated below, with football, hockey, rugby, and boxing. But it could also be riding skateboards, riding bikes, and just overall being outside and participating in activities. And another risk factor is having a previous brain injury as well. The pathophysiology of a concussion. A concussion is damaged neurons within the brain. A concussion induces massive neuronal firing with the release of excitatory neurotransmitters such as glutamate. These neurotransmitters cause the neurons to continue firing at the same time, causing a massive influx of calcium into the cell. And the problem with that is that when there's a massive influx of calcium, the neuron becomes overworked. It does not fire properly. And as you can see in this image, at the end of the neuron, there's massive release of neurotransmitters that interferes with the cell communications. And during this time, the nerve cell is extremely vulnerable as well, and further injury or stress could cause cell damage or serious cell death. The symptoms of a concussion. So, the symptoms of concussion have four simple groupings. There's a thinking and remembering, physical, emotional mood, and sleep disturbance. And within these, there are some standout symptoms that most people relate with a concussion, like difficulty thinking clearly, headache or nausea, dizziness, irritability, sadness, and also with conjunction with sadness is depression, and also less sleep. And all the symptoms that I haven't stated yet aren't as prevalent, but do happen. The diagnosis of a concussion. So the problem with concussions is that there's no surefire test to see if you have a concussion or not. Most schools and organizations, before you start high contact, either sports or activities, have a baseline test for you to complete. So they have some groundwork to see if you have a concussion or not. And the problem with concussions is that it's all on the patient's side if they could lie or not. So the patient self-reported symptoms based on a symptom scale. And the issue with this is that a patient could always not tell you their correct symptoms that they have. They also have balance testing for diagnosis, neurocognitive assessments, as in the test and other assessments that could happen before entering into the high contact activities, the timing of your symptoms, and if symptoms worsen, computed tomography, which is a CT scan, or magnetic resonance imaging, a MRI, to check if you have any larger issues going on with your brain, maybe hemorrhaging or any other issues due to the contact. And the diagnosis outcome. So if you are diagnosed with a concussion, there is a common protocol to follow. So cognitive rest and physical rest go hand in hand. Between 1 to 2 days, you're supposed to sit out, stay home with a lack of stimulation to let your brain heal and go back to normal for the most part. There's medication and intervention, and with medication, there isn't a drug for you to take that helps with a concussion, but you can take ibuprofen and Tylenol, which will help with the headache symptoms that you may be experiencing. And intervention is making sure the patient stays away from stimuli that may hurt the brain further. And after those 3 steps, the most common thing that happens is going back to school or work and a gradual return to the extracurricular activity that may have caused the injury. And after all of that, you still have to assess the risk to make sure that the patient's brain has healed correctly. And treatments. And like with a concussion as well, there is no definite treatment to cure concussion. But you can have supportive care, which is people helping you out, making sure you don't do too much and making sure your brain is as stimuli free as possible. You will need attentive observation to make sure your symptoms don't get worse, and obviously the limitation of physical and cognitive activity. And for the end of this presentation, I will be talking about post-concussive syndrome. So PCS is a constellation of physical, cognitive, behavioral, and emotional symptoms occurring after a concussion. So all the symptoms that I had brought up before, post-concussive syndrome is all those symptoms lasting longer than 3 weeks. And PCS is diagnosed when the symptoms last longer than 30 days. Some risk factors for post-concussive syndrome. Sadly, a risk factor is being a woman. You are more likely to endorse a headache, irritability, fatigue, and concentration problems due to a concussion. And the increases in age are also associated with a higher risk of PCS as well. The post-concussive syndrome pathophysiology is the result from a autonomic nervous system damage. This damage occurs to the white matter tracts between the cortical control centers and the vagal nerve control via the spinal cord. And due to this is the prolonged symptoms of a concussion. And here are my references. And thank you for listening today.